Hi, my name is Eddie Murphy. I work with Elder Services of Cape Cod and the Islands. I oversee the Elder Protective Services Department. What we do is we investigate reports of elder abuse, neglect, and exploitation. The reason I joined this coalition is because I see each day at work how many seniors are impacted by abuse and neglect on Cape Cod and the islands. And I think the more agencies that work together, the more likely it is that we can maybe work to help some of these seniors. So if you suspect elder abuse or neglect or exploitation, please call the statewide hotline, which is 1-800-922-2275.
Hello, welcome to the Cape Cod Elder Abuse Coalition Roundtable. Elder Abuse Coalition has been formed about 5 years ago, and it's made up of a multidisciplinary group, and today we have a few of our members. So I'm going to have them introduce themselves, and then we can get started. Eddie?
I'm Eddie Murphy. I work with Elder Services of Cape Cod and the Islands, and my role there is I oversee the Elder Protective Services program.
And my name is Brenda Vasquez. I'm the director of the Dennis Center for Active Living, and I am a gerontologist.
And I am Chris Morin. I work at Independence House, and we serve those who are affected by domestic and sexual violence. I'm also director of prevention, education, and outreach. Annie?
Hi, I'm Annie Catalano. I'm the civilian victim advocate with the Yarmouth Police Department, and also a member of the Cape Cod Elder Abuse Coalition.
Hi, I'm Dr. Joseph Gordon, the Emergency Management Director for the Barnstable County Sheriff's Office, and I'm also the Sheriff's liaison to all 15 senior centers throughout Cape Cod and the islands.
Okay, thank you. So we'll get started. Before we go into elder abuse, just kind of give an overview of how people see aging in America. So we find that media and marketing kind of promote ageism as a negative, in a negative way. And in fact, if you pay attention to the advertisements, it's really about how not to grow old, right? A lot of medicine and pills and creams and such. So when we talk about elder abuse, we want to address the fact that people are not maybe comfortable in expressing themselves and disclosing and such because of the image that's out there. So the coalition is primarily about raising awareness about this issue and what are the resources and who can help. So those are the objectives of today. So I'm going to start off with some questions, and I'm going to start off with you, Eddie. So from a major institution that deals with elder abuse, what are some of the common forms of abuse that you see in your work?
So the types of abuse that we see self-neglect is a really popular one, unfortunately. There's a lot of seniors on the Cape living alone that don't have enough resources and they're not meeting their essential needs. We also deal with physical abuse, emotional abuse, verbal abuse, sexual abuse, as well as financial exploitation. And then also there's caregiver neglect. So those are the forms of abuse that Elder Services investigates. And we work with elders that are 60 years of age and older. So there's a lot of different types of situations that we're dealing with, but those are the types that we are dealing with each day.
And Eddie, how many calls do you get a month?
Currently, we get about 180 reports each month, and sometimes in the summer months, we get close to 200 reports each month. Those are not all substantiated, but we are getting that number of intakes and reports to investigate.
Right. Okay. Wow, that's a lot. So, Joe, you mentioned that you were the liaison to the directors of senior centers. So, what is the Sheriff's Office point of view of why that liaison, the importance of it?
Well, the importance is, first off, the Sheriff's Office has a history of being engaged with vulnerable populations. We have a youth program that goes out into the schools throughout Cape Cod, And we have our Elder Services program, which I'm involved in getting out, doing public outreach, interacting with the Council on Aging directors and their outreach coordinators, and trying to promote awareness on the issues that Mr. Murphy just spoke about. And we a whole host of programs, not just what we can do for them, but we like to hear their feedback on what they expect of us. So there's a lot of engagement, and I'm fortunate that like Ms. Vasquez is here from the Dennis Council on Aging, and having those great working relationships with all the Senior Center Council on Aging directors.
Well, you mentioned Brenda. So, Brenda, from your perspective as the director of adult living,
The Center for Active Living.
Center for
Everyone's
Active
getting used to
Living.
that.
why is it important for senior centers to be aware of this issue and be a resource for people?
Well, senior centers, you know, Chris, and everyone here is probably aware, is probably the main hub, the main focal point in the community where seniors get their information, they receive services, they apply for benefits, they meet their friends, they'll come to the cafe. This is the hub of social life for the older adult. And so we believe that not only is it for recreational and socialization purposes, but to really meet human needs. And our focus and our philosophy at the Dennis Center for Active Living is, yes, come and eat and drink and be merry and have all the socialization and recreation, but as well to make sure that you're truly healthy. And we all know that the social determinants of health, and we've been hearing these terms go on, but that happens in community. That doesn't happen in the doctor's office. That happens at the senior center. Your health, your quality of life will happen when you're relating to other folks, when you're getting your needs met, whether it's your transportation, your proper nutrition, because you know we all eat. It doesn't mean we all eat what we should to maintain health. And so we're very focused on meeting all of those needs that support health in the community. And safety is a major part of that. So, yeah.
Thank you. So Annie, Eddie mentioned the calls that they get. And so as a domestic violence advocate with the police station, how often do you see this? How often do you, what's your role there? How do you fit into the police station, and then about how many calls do you get in a month?
Sure. So my role at the police department is to follow up on any reports of domestic or sexual violence, stalking, dating violence, anything like that. And it's really just figuring out what the person needs. Safety planning is sort of my number one priority, and then getting them connected to whatever the most appropriate services are in the community to help support that person. So additionally, speaking about elders and the reports that we get about abuse, like Eddie was talking about, I would say in a given month, it varies from month to month, about 30 to 40 reports are what we see. And of those 30 to 40 reports, about 12 to 15 of them are specifically with an older person. And then in addition to that, what we sort of do, it looks different for every person. So it's trying to figure out what are their immediate needs, and then what are some of their longer term needs. Sometimes it's working with the person directly, and sometimes it's working with their loved ones or caregivers or family members. A lot of it will look like getting connected to elder services and the stuff that Eddie talked about and the services that they can provide. Sometimes it's getting them connected to Linda, our social worker at the Yarmouth Senior Center, who's also part of this group. Sometimes it's helping them work through the criminal justice system if there's charges that are going through. Sometimes it's helping with protection orders so they or their family can feel safer in their home. It's a lot of different things. We also have a great team of mental health clinicians at the police department. So oftentimes we'll work together on these specific cases where they do a lot of outreach in the people's homes. And sometimes for me in my role, it's a little bit more dangerous. So I don't usually go out to people's homes, but can. But that's their jobs, to go out to homes and assess the situation and make those mental health referrals or medical referrals. And again, we're all working together as a big team to really support that individual as well as whatever family or loved ones that they have involved so that they have the services that they need.
Great, thank you, thank you. So Eddie, I work at Independence House, and we serve survivors, any survivor of domestic sexual violence. You also address older adults in abuse. So what is our difference? I can say mine, and you can say yours.
So how we get involved is somebody files a report of concern in the community. It could be a professional, a mandated reporter like a doctor or a nurse or a police officer or fire department. But we also get reports from elders themselves and family members and non-professionals. So it starts with somebody filing a report with the statewide hotline, which is the 1-800-922-2275, and that's a statewide hotline to file reports of concern about elders that may be at risk of being abused. And then it comes to our local agency based on where they live, and we cover the Cape and Islands. And at that point in time, if it reaches a certain criteria, a caseworker will be assigned to go out and meet with the elder in person and discuss the concerns. There's a lot of different factors. It could be unsafe, so sometimes we might go with 2 workers, or sometimes we might go with the police. But generally, we're going to go and meet with that elder in their home, hopefully, and have a conversation and discuss the concerns. If there is an alleged perpetrator in the home, we're going to try to work around that to make sure that they can be interviewed where they're able to disclose and talk about the concerns. So sometimes we might meet with an elder out in a public place if they've agreed to that, or go at a time when the alleged perpetrator might not be in the home. And then, so that's kind of how we start. That's how we kind of get involved. Somebody files a report of concern, and then we have a caseworker go out and try to discuss the concerns with them in their home in most cases.
So your investigation primarily, and Independence House is primarily counseling. And so I know that Elder Services and Independence House refer to each other. And so we find that it's hard for somebody older to pick up the phone and call us. So we try to be out in the community as much as possible. And we have connections with the senior centers around the Cape. Many of them, Dennis being one of them. We have office hours. So we are looking at ways to outreach into the community and make it safe to disclose. That's I think the biggest piece. So we've kind of been talking about how we fit into this coalition with our particular jobs. So
I wanted to add just a point to the office hours. I think that's such an important partnership, and how we should be thinking about how we address a lot of these issues. And for example, what Joe was making reference to as well is working collaboratively with all the centers to make sure that the center directors are aware that they have this resource, and that people also know that they have this resource through their senior center available to them as well. So one of the things we've done in Dennis is to create this kind of this human services wing where we have rotating agencies coming in to offer office hours on site, so that folks necessarily that can't get to another town, to Hyannis, could actually come right in their town and see a representative from the agency at a specific given time. So it might be something to look at for spreading that.
right. And to add to that, it's sometimes a safer place to say, if you're living with your abuser, to say you're going to the senior center versus going to Independence House, or you probably wouldn't even say that, but that's a really good point. Yes, the senior centers are a hub for seniors, and so our connection with them is really important. Absolutely. So.
Can I add one more thing, Chris? Sorry, before you move on.
Oh.
Talking about a lot of what we're talking about here today is how difficult this topic is for people to bring forward. Yeah. And just wanted to add on to what Eddie was saying, a lot of times their reports come in from mandated reporters, like and us as first responders as well. And sometimes what will happen is we see a 911 call will come in as a medical call if someone has fallen. Mm-hmm. The fire department gets those calls every single day. And so sometimes what will happen is they'll show up to help the person who's fallen and say, I think we've been here before for the same person, for the same situation very recently. And, they start to look around and they see some clues and say, maybe something more is going on here, and maybe this is not a safe place for this person to stay. And a lot of times that's how the report will become generated. And sometimes they'll call us and let us know, like, hey, I think something more might be happening here, and that's when we'll send a mental health clinician in. So again, we're talking a lot about teamwork here, and I just wanted to add to that because that's what I see happening every day. And whether they get to every one of our agencies or some of them or all of them, we're really always trying to have open communication with each other to be able to, again, just bottom line, get that person the safety that they need, their basic needs being met. Sometimes they go in their home and see that they probably haven't eaten or don't have any food in the fridge, but maybe are embarrassed or don't know how to ask for help or don't too much pride, whatever it is, there's things getting in the way of them asking for help. So sometimes these more difficult things happen, but the good that comes out of it is that we can get what that person needs to them in a way that hopefully is a lot more comforting and sensitive and not full of stigma.
Right, that's a very good point. Let's, anybody can join in here, but I'll start with Eddie. Knowing the signs of abuse is a really big piece of this, right? So that one of our goals, again, in making this issue visible, is that people in the community who aren't necessarily working in any of these areas, right, would see the signs and know what to do with that. So Eddie, just some signs that you see or
Sure.
your advocates see.
Well, any like unexplained bruising could be a definite sign of abuse. It doesn't mean it was abuse, but it's a possible sign. Unexplained lack of funds or different, variances in banking, the ways that people use their bank accounts. If they're unexplained loss of funds, sometimes could be an indication that there could be financial exploitation. If like Annie mentioned, somebody going into a home and seeing certain things, it could be a hoarding condition. It could be the utilities being cut off because they're not managing their finances. They could be getting late notices. They might be getting evicted if they're not paying their bills. So there's a lot of different types of abuse, like we mentioned earlier, and there are lots of signs. But oftentimes, one thing that you can do is kind of ask some questions. And I think the professionals that respond to the calls, like Annie mentioned, know how to ask those questions, and it might be more challenging for non-professionals and family members to ask those questions. A lot of the cases that we are dealing with, the person that might be doing the exploitation or being neglectful is a loved one, is a family member, and that makes it even all the more difficult for elders to disclose what's going on, and it might be more difficult for family members to see and identify that their loved one might be getting hurt or not meeting all their needs.
Right, absolutely.
And what we see with that is not just their fear of coming forward, but their fear of isolation. When they do cross that threshold, they don't want to tell on the family member, because then they don't have anyone in the house with them on a regular basis, and that's where they fall into a trap of repetitive exploitation and so forth.
And sometimes there's a concern that am I going to end up losing my home? Am I going to end up in a nursing facility? And that's really scary. And that's not the goal of elder services in any way. But those are the things that I think people are considering and are making them less likely to pick up the phone and call.
Yeah. Or sometimes it's an in-home caregiver, similar situation where they may not live with them, but they come by every day, multiple times a day. They give them rides to their appointments, or even rides to things that are not even doctor's appointment, like getting your hair done or seeing your grandkids or something like that. And they think they're going to lose that if they have to report that maybe this person's been stealing from me or hurting me.
It definitely is a dependency role that fosters itself over time. But if you're being exploited or you're being taken advantage of, you have to come forward. Your situation isn't going to get any better by remaining silent. So there's a lot of programs on the Cape that we could, elder services is out there, your local council on aging's, Independence House. You got victim advocates like Annie here, to utilize them, reach out to them. But and that's what this whole coalition came about more than 5 years ago, to try to promote that awareness and get the not just for the public safety folks to learn what the signs are of elder abuse, but for the elders themselves to understand what's available to them and what course of action they need to take. So it's really important to stand up when something isn't going right. And there are other people, like she talked about, the home care aide, that someone's going to replace them when they're removed from your house. So don't panic over that.
Yeah, I think it's also a good time to mention the fact, I think you're talking directly to neighbors, for example, or people that are bystanders, or folks that could just be observers of situations that might be happening. And so also to give them a vehicle, a channel to be able to report or to communicate what's happening without compromising perhaps themselves in some way. You don't know what the situation is behind the closed doors. And so sometimes that may hinder people
Right.
from sharing.
Yeah, and so because you don't have to be a mandated reporter to call elder services, and I think that's something probably people don't know. We'll have these numbers posted at the end of the program. And so what's come to my mind is what is prevention? I always say that we are a crisis culture, not prevention. We know what to do in a crisis. We're actually nice to people in crisis.
Right.
And so the programs that are in elder services and the programs that are at the senior centers, they can be part of prevention if we were to somehow be able to promote them more and get maybe transportation is always an issue, that type of thing. But Eddie, what are some of the programs that elder services offers? I know
So-
Meals on Wheels.
So
is one.
Meals on Wheels is the most identified one generally, and that's a great program. We have, I think, well over 1,000 volunteers like helping
Wow.
deliver meals throughout the Cape and Islands,
Wow.
Monday through Friday, and they also have meals that seniors can have for the weekends as well.
Congregate,
Yeah, and the congregate ones in many of the senior centers as well. So that's a great. It's a daily safety check as well as a meal. We've gotten a number of calls. If somebody doesn't answer the door, there's a follow-up process to make sure that they're safe. There's a home care program that kind of oversees putting like home health aides into seniors' homes, as well as they have some help with med management, ways of managing elders' medications, and we also there's an ombudsman program as well. If you have a loved one in a nursing facility, and there's somebody in that facility who's also a volunteer that could look into concerns within that facility, and that's the ombudsman program. And that's just a few we have a lot of programs at Elder Services, but generally you can call the main number, the 508-394-4630, and ask to speak to somebody in the intake and referral department. And if you explain what you're looking for, they'll be really helpful in putting you towards the right program.
Can I just add to something?
Sure.
The Meals on Wheels is a great program, but I used to be the co-coordinator of the Bourne Friends Food Pantry in the town of Bourne. And I know a lot of elders are out there and they're homebound and they can't get to the food pantry. But most of your food pantries on the Cape, if you reach out to them, they will home deliver your food to you once a week at least. So I highly recommend getting in touch with your local food pantry if you're low on budget and you need food items.
Yeah. And I can speak to Dennis for that. I mean, we have a very robust, it was a major piece of my grad work actually, is food security, and it's an important piece of quality of life. And we basically we have an in-house pantry for folks that can come if they have an emergency need for food. They can shop locally in the senior center itself. In addition to that, there's the mobile food pantry. They come again once a month. There's the outreach department's visit to the pantry itself for shopping, and we also offer delivery for persons that are homebound as well. So Dennis has a variety of services in this area of food security and transportation especially. These are two big areas of concern for us. And our Dennis Police Department as well has a mental health task force that they were funded to provide. So both Dennis and Yarmouth are truly leaders in this area, and I'm really proud that Dennis got on there with the funding through the police department to offer this support. So.
And so we're coming to the end. I just wanted to ask, again, senior center wise, mental health is very important, obviously. Activity and play at any age, especially our age. So can you name a few of the activities that you have at the senior center? I've been very impressed with the senior centers. If I want to do a program there, I have to call 6 months ahead to get into the calendar. So just a couple that really get our brains going, but it's socialization, it's addresses a lot of things. Mental health is a piece of abuse where, yeah.
So, I mean, we're definitely, I can speak for Dennis because that's where I work. And for sure but I also had really great teachers. So in Yarmouth, we had Kathy Bailey, who started the whole kind of age-friendly movement,
coalition, yeah.
this coalition. But, you know, I kind of come from that school of thought where, you know, we have to create these opportunities for people, not just to socialize and engage, but to keep them vital and active. And, you know, there's value to individuals that come to the senior center. So service with a smile, but also developing the programs that are evidence-based and that we know. We've invested many dollars on research and to gather evidence for programs that actually work. We know music, and these are not costly programs. With a little music, you could do a lot. With a little movement, you can do a lot. So if you create the right environment and you have these kinds of vital types of activities where you involve music and the arts. I love how Alzheimer's Family Support Center does this with the dementia community. So, you know, we are in the middle of a renovation again. We're going to be doing the original part of the center, and so in those spaces, we'll be bringing back performing arts. You know, I don't know if you're aware that Dennis Senior Center used to be a performance venue at one time with Paula Dolan, who was Clarabelle from Howdy Doody. I don't know, maybe I never watched Howdy Doody, but she actually was a director of the center, and so we'd like to bring activities that engage people socially, but also learning new things and new skills and having new experiences. We were talking about the science of joy, and you know, if you're not enjoying it or having fun, you're not going to really want to do it. So we need to make these activities fun, and there's a lot going on in my senior center in Dennis, but also in Yarmouth, and all the towns on the Cape have amazing centers.
Okay, thank you, Nick. Yes, keeping us active is you know, part of staying healthy. So I'm going to close with just some information about our coalition, in the sense that besides these kinds of opportunities where we can be visible, two of our goals are to stay in touch with legislation that's that's up in Beacon Hill. We want to be advocates for what legislation is in, what do they call it? In the pipeline. So there's hundreds of bills up there about older Americans. So we're going to be looking at about 5 of them and pay attention to them, support them, and then let the community here on Cape Cod know about them so that they can make their calls and such. We're trying to be visible that way, but also involve the community. So we just want to wrap it up with a statement that we're all part of our Cape Cod community, and we're all responsible for this place that we live. And so hopefully you have learned today some of the signs that there is fear involved in reporting and disclosing, but silence keeps abuse alive. I'll just say that. So we're hoping today that just to be aware of this coalition, the resources that are out there, and when you see something, it's overused, but when you see something, say something. You can call elder abuse, call the hotline, Independence House, check with your local police department, sheriff department, senior center. We're all here to help in any way to give you the resource you need. Thank you very much. Thank you, each of you, for your time and your knowledge.
Thank you.
And have a good day.
I'm Annie Catalano, victim advocate with the Yarmouth Police Department. In 2020 alone, there were more than 100 incidents of abuse, fraud, or neglect reported by someone over the age of 60. I joined the Elder Abuse Coalition to let the local community know that I'm here to help connect you with support services and safety options.